UPMC announced today it's immunized almost 42,000 members of its staff with at least one dose of the COVID-19 vaccine. It's also vaccinated non-UPMC employees like nursing home residents and EMS. Earlier tonight, I caught up with UPMC's Dr. Snyder to ask him how it's going. What is it like right now in UPMC when it comes to the numbers and statistics for vaccinations?
So we are taking all the vaccine that has been distributed to us via the state and administering it as fast as we can. And stepping back, the U.S. public health approach up through today has been to focus vaccination on the phase 1A group, which is healthcare workers. It also includes people who are living in a long-term care facility like a nursing home.
What is the level of interest that you're seeing here in Pittsburgh? Is it an excitement? Is there hesitation in comparison to other big cities?
It's intense. Throughout the whole pandemic, the response to COVID-19 and people's concerns and their interest has been higher than I have ever seen. But for the vaccine, it's a multiple of that. I think people are very excited about the possibility that this contributes to the end of the pandemic, and I share their excitement. So we're seeing acceptance rates for our healthcare workers in the 75 to 80% range for healthcare workers at UPMC among those who have responded to our invitation to get the vaccine. That exceeds my expectations, but is right in line with the enthusiasm that I hear when I'm talking with my colleagues.
Can you explain the side effects that people could expect when they eventually do decide to get the vaccine?
The idea behind a vaccine is that it is teaching your immune system to respond to the virus. They may be general achiness, they may be tiredness, a headache. You may even feel like your temperature goes up, even a low-grade fever. Those are going to be more pronounced with the second dose rather than the first, because the second dose is that boost to your immune system. So those are expected symptoms. Not everybody has them, and that's okay. If you do have them, I would interpret them as a sign that your immune system is getting ready. And if you don't have them, it's okay. The vaccine is still working.
Are you guys already planning for what happens when everyone else would be able to get the vaccine? Would UPMC be able to give it out to someone like myself or someone who doesn't fit the categories that you just mentioned just yet?
Absolutely. And we'll follow the lead of the Pennsylvania DOH so we can work in partnership with our public health colleagues and other organizations throughout our area. There is some breaking news today that the CDC may change the prioritization. So as with everything in this pandemic, we will adapt to the public health response as it adapts to the pandemic. And what we're expecting to hear is that the CDC will now prioritize individuals who are 65 years and older throughout the community. So we have already been getting ready to administer vaccine to the general public beyond healthcare workers, and this will be part of our process to do that.
Yeah, definitely good news for everyone that is happy and looking forward to receiving this vaccine. Dr. Snyder, thank you for taking your time and for keeping us up to speed on what's happening with UPMC.